When is surgery actually needed to help chondromalacia patella? In my strong opinion, I think that surgery is never needed for chondromalacia patella. Now I'm going to explain why. See, most surgeons are looking for you to meet 3 criteria in order for them to give you the green light and go ahead with the surgery. The first criteria is that you have knee pain, obviously, because if you don't have any knee pain, why fix something that isn't broken or there isn't a big problem? Then the second criteria is that they found something in the knee through an x-ray or an MRI, something that could be surgically corrected. So in other words, if they're looking at your MRI or x-ray and they find that there's an issue with the cartilage back here that they reason they have a surgery that could help it, then that's another box that they can tick on moving you towards surgery. But the third thing is that you've tried everything non-surgically, all the treatments that don't involve surgery, and that they have not been successful for you. If you've gone through a bunch of different treatments, and it's usually medications, injections, and physical therapy or exercises. If you tried those 3 things, then the surgeon will come back and say, you've done everything that you should have, your knee still hurts, and there's something wrong on the MRI, let's go ahead and do surgery. But there's nearly always something that people with chondromalacia patella haven't looked at or haven't even addressed or touched that is causing chondromalacia patella. That's the root problem of chondromalacia patella. And that's looking at the muscle imbalances around the knee that are causing there to be excessive forces. Because if you think about the root problem, nobody really asks, think about this, nobody really asks what causes chondromalacia patella. I mean, patients ask, they ask me all the time, and I would assume that they're asking their doctors, but the answers that they're getting are not really thought out. They'll say something just like, well, people tend to get it at this age. Well, if you're in this kind of sport, it tends to happen. If you're like in a jumping sport, for instance, like basketball or volleyball. If you're a runner, you might end up getting chondromalacia. They'll blame it on an activity, or they'll blame it on too much of that activity, which I think is baloney, because if they're blaming it on an activity, how come everyone else in the sport doesn't have it? Yeah, it might be more common in that, but there's people that are playing basketball, there's people that are playing volleyball, there's people that are running that don't have chondromalacia patella. And there are people that are that age that don't have chondromalacia patella, so it doesn't make sense. I think that's just a superficial answer that doctors are giving because that's what they were told in school, and that's maybe what they were told by their mentors, and so they're just kind of regurgitating it to you without really fully thinking it through. But I have thought this through, and I'm going to tell you what the root cause is right now. Let me explain. Here you have a knee, here's the patella, there's cartilage behind the kneecap right here, the patella, and there's cartilage on the end of the thigh bone right here where the kneecap moves on the thigh bone, and there's a groove right here on the thigh bone where the bump on the center of the kneecap fits. And so it sits there, and that's where it moves. In chondromalacia patella, chondromalacia means small cartilage or shrinking cartilage or thinning cartilage, and they're referring to the patella, the kneecap. So you're having small, thinning, shrinking cartilage on the back of the kneecap. And that's what's causing the pain, irritation, inflammation, all the issues that you're dealing with if you have chondromalacia patella. The root cause is that the muscles above the kneecap, on the front of the thigh, the quad muscles, are usually way too strong or too dominant. They're being used too much. Maybe you're not a very strong person, but you tend to use your quads a lot when you're doing everyday activities or the exercise that you do. When those muscles are too strong or too dominant, then what they do is they're constantly pulling upwards right here because they get what's called a resting tension, an increased resting tension. And when you pull upwards like that, it butts the kneecap against the thigh bone on a consistent basis. I mean, you could just be sitting around, and because the muscle's stronger, more dominant, it's just pulling the kneecap into the thigh bone more. I mean, if you sit down like this, it's just pulling it in, and it's squashing the cartilage back there, and if it's not prepared to take that, then it becomes irritated and inflamed and swells and hurts when you move. So if that's the cause to chondromalacia patella, then we have to take the pressure off. And going back to the criteria that the surgeon has, you have knee pain, then 2, there's some problem there, and then 3, you tried all those things, medications, injections, and physical therapy. Well, medications don't fix the muscle imbalance. They take away the pain temporarily. Injections, same thing as medication, it's just injected into the joint, so it takes away the pain temporarily, maybe a little bit longer than oral pain medications or when you take by mouth. And then when we talk about exercise, by physical therapy usually, a doctor is likely to send you to a physical therapist to help your chondromalacia patella. But think about the physical therapists. Now, especially if you have the experience, and you're gonna know exactly what I'm talking about. You get sent to a physical therapy place, and they'll have you start doing exercises to help your knee pain. But if you look around at the different patients that are there, it is often the case that most of the patients there are there because they had a surgery, and so they're there to recover from a surgery, which means that the physical therapist clinic that you're going to specializes in helping people recover from surgeries. Surgical recovery is what most physical therapists are excellent at. That's what they tend to do. That's what they train to do in school, and they tend to be really good at it. Helping somebody avoid surgery, as you might be doing here, if you have chondromalacia patella and you don't want surgery, is not something that those physical therapists usually do. So as a result, you might end up doing the very same exercises or versions of the same exercises that the person that had the ACL repair is doing, or the person that had the knee replacement is doing, or the person that had the meniscus repair is doing. But they all had surgery and you didn't. So why are you doing those exercises? Doesn't make sense. It goes back to their training, their mentors. They're doing what they were told to do when they were in school and when they were being mentored. But it's a completely different specialty. There's a completely different set of tools and experience needed to successfully help somebody avoid having surgery for chondromalacia patella. And those exercises are not like the ones that somebody's recovering from any of those knee surgeries should be doing. Those exercises are focused on getting mobility back, because after surgery your knee doesn't bend or straighten out very good and it's painful to walk on. But if you have chondromalacia patella, you need to take pressure off the kneecap in order to let the cartilage heal and allow your knee to not swell when you go do activities, allow you to get back to running, jumping, weightlifting, even just everyday things without your knee hurting. Now let's circle back to surgery. Surgery usually has 3 goals. So let's say the doctor's talking to you about surgery and you've had pain already in your knee, they've checked that box. You have a finding on your MRI or your x-ray, they've checked that box. And then you've tried everything as far as like medications, injections, and you went to physical therapy and it wasn't successful. None of those things helped your knee pain. So now the doctor's gonna start to heavily consider surgery. Now there's usually 3 goals of surgery, and the first goal is usually to realign the kneecap, because there's a belief in the medical field that the kneecap can change its alignment. And I disagree. There's a whole other video that I've made on YouTube about this, but it's usually the thigh bone that changes, not the kneecap. So by getting a surgery to adjust the position of the kneecap, they call this a lateral release surgery, where they cut the tendons on the side, would be on this side over here. And the idea is to get the kneecap to sit better where this part sits in the groove. But this is faulty thinking, because it doesn't change the muscle imbalance. If that's the root cause, if the root cause is these muscles up here in the thigh are too strong, then adjusting the kneecap position isn't going to really make a huge difference. It might make a small difference. You might actually feel some improvement after surgery, but it is likely the case that afterwards people continue to have knee pain because the root muscle imbalance has not been addressed. It's just a matter of time before the kneecap in its new alignment starts to rub too much, because these quads are just pulling the kneecap up against the thigh bone too much. Another goal is to get the cartilage to heal behind the kneecap. And so they'll do a microfracture surgery where they drill little tiny holes into the bone past the cartilage in an effort to get the cartilage to regrow back here. And sometimes it's successful, oftentimes it's not. And the reason is because that root muscle imbalance is still compressing the cartilage back there, so it doesn't allow the cartilage to heal properly. I think it's a brilliant surgery. Whoever came up with this surgery is thinking excellently, except that the root problem hasn't been addressed. And so in the individuals that still have massive muscle imbalances, they're not going to be successful, because they're still applying lots of pressure when you need minimal pressure to go through the kneecap here to properly heal from the microfracture procedure. And then to make sure that your knee cartilage is still healthy for years to come afterwards, you need to get rid of that muscle imbalance. And then the third surgery, which is the most common, is to smooth the surfaces behind the kneecap and on the thigh bone. They'll call this a debridement surgery. They might go in and clip parts of the cartilage back here that are rough. They might smooth it out a little bit. Sometimes there's a loose body floating around that they'll remove. Sometimes they'll smooth out this part of the bone on the cartilage on the end of the thigh bone. And then in extreme cases, they'll completely replace your kneecap with an artificial kneecap that is going to be smooth so that you can have proper motion happening through the knee. But again, none of these surgeries fix the root muscle imbalance. They're all not hitting the point. They're not hitting the main point, the main reason, the root cause of chondromalacia patella. Now lastly, consider this. If chondromalacia patella is not treated surgically, what happens is it's on a spectrum of knee problems, and it's the beginning of the spectrum because chondromalacia patella tends to happen to younger people in their 20s or 30s. Sometimes even teenagers get this issue. But there are lots of people that never have surgery for chondromalacia patella. Maybe it flares down and it becomes tolerable or manageable and they just kind of live with some knee pain. They start to give up things because, face it, once you leave high school age, a lot of sports leave your life. Your identity changes. You're no longer the athlete. Now you're in college or you're working. You become a parent. Life just changes. And so your schedule changes, your activities change, and maybe you're better able to manage your knee pain as a result of no longer running so much or playing football or doing volleyball. And so people adapt. Then if the muscle imbalance is still there, maybe they're still dealing with knee problems, you might get a meniscus tear later on in life in your 40s or 50s. And then by the time 60s come around, if you still have that muscle imbalance, knee arthritis sets in, osteoarthritis. It's on a spectrum, and chondromalacia patella is towards the beginning of the spectrum, and it ends with knee arthritis. And if knee arthritis progresses, you could get a knee replacement surgery. So what I'm saying is, consider this. If there are so many people that have chondromalacia patella that make it past their younger years and get to the point where they're developing knee arthritis, then maybe it's possible for you to hold off. It's the same root problem in knee arthritis. You still have a muscle imbalance that's putting too much pressure and causing all those bad forces to go through the knee joint, and it's causing arthritis now at this point. Some of those people don't even have surgery. They live with knee arthritis into their older years, and they even pass away never having had a knee replacement surgery. Some do end up having surgery. But if those people can make it, can't you? Is it possible that you just need to flare your knee down a little bit, get the pain under control so that you don't have to have surgery? This is why, like I said at the beginning of this video, I strongly believe that surgery for chondromalacia patella is not necessary. If you can get the pain to flare down, if you can start to fix the root problem, then it's possible that even though you have something visible on your x-ray, you have some chondral defect, some problem with the cartilage behind your kneecap, or you feel like the alignment's off, or they do some x-ray measurement tool to see where the alignment is, that can all be corrected non-surgically by fixing the root problem, which can put you in a position where in your younger years, in your teens, 20s, 30s, you get over your knee pain, and you get over it for the rest of your life because you know how to address the root problem that leads to your knee problems. If you can do that, then you should be able to be fine into your later years of life, all the way to your last days on earth. I have got tons of videos here on YouTube that talk about advice, exercises, tips on how to treat chondromalacia patella at the root of the problem so that you're not dealing with it the rest of your life. I've got them all packed into a playlist on YouTube here. It's called the Chondromalacia Health Playlist. There's a link to it in the description below. And they've also got a program that has my entire treatment approach, the same things that I talk to my patients in person, the ones that I help recover from chondromalacia patella, the ones that I help to get off from the schedule with the surgeon. I have that whole treatment approach in a program called the Patella Pain Recovery Program. It's linked in the description below. Go find that link, click on it, and you can learn all about the Patella Pain Recovery Program. There's over 30 videos, me walking you step by step through what to do to get the pain to flare down, to fix a root problem, and to get back to high-level activities like running, jumping, weightlifting, all those things without knee problems, and being fully confident that you can use your knee for anything that you want to do in life. Hey guys, if this video was helpful for you, please give us a thumbs up. Please subscribe to our channel if you haven't, and turn on our notification bell so that you can get notified whenever we release a new video. And check out a freebie. We have a freebie, a case study of somebody who's got a chondromalacia patella problem. I've got a link in the description below. And don't forget to drop comments on here if you have any questions. Tell us your story. If you've already been watching our other videos and have been helped by our chondromalacia videos, let us know. We love to hear that. It makes our day, and I'm sure all the other people that are watching this for the first time can benefit a lot from hearing about it. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.